Very good afternoon, everyone. I'm Justina here. Now, before I start my talk proper, I just wanted to introduce a little bit about what I do. Now, I'm actually the director for LPDD from the Institute for Adult Learning. Now, those who actually want to be the adult trainers, you know that you have to take your ACTA and the ACLP. So this is a program under my division. Now, my division has also expanded to include enterprises. And one of the key things today, I hope you can take away from you, and which is the directions for the government in the coming years, is workplace learning. Okay, I will share more a little bit about this. Now, then, before I go into the principles proper, I just wanted to share a project I did with SingHealth, and that's how I got into this, this talk with you guys. I did a social prescribing project with them. I'm a consultant myself. So one day, SingHealth approached me and says, we want to equip the elderly so that when they actually are discharged from the community hospital, they are digitally literate and can actually live independently on themselves. This is during the pandemic itself. So what we did was that we worked with the well-being coordinators to actually refine the curriculum and delivery so that the old folks actually remembered what they have learned. I'll give you an example. It's very interesting. When we design anything or talk about adult learning principles, right? One of the chapters that the elderly are supposed to learn is about dialing, calling someone. To us, it's so intuitive, right? We picked up the phone and call. So when we design the curriculum, we design based on our perspective. So what happened was that there was an elderly man who actually was supposed to demonstrate how it's going to be done. So he picked up his mobile phone and he stood at a distance. And people were trying to call him and was trying to call people based on what he had learned. Now, but then he kept saying, hello, hello, hello. Nothing. You know why? Because the volume of the mobile was at 0. He didn't know that actually the mobile, the volume need to be up to hear. Nobody taught him how to up the volume. But as adult ourselves, right? When we call somebody, we know that intuitively, we know how to up the volume. So what I'm trying to tell you through this story is very interesting. We laughed about it, but this is a very strong lesson to learn from it. When you do any design or when you think of conceptualization, it's never you in the picture. It's always the learners. And the learners, right, we're talking about here are adults who actually form a spectrum. We have very cognitively able, educated. We have the other end of the spectrum, who are the elderly that we somehow, we're actually dealing with. So I hope that you can actually also remember. This is a very tidbits of a story, which I thought struck a chord. Now I'm going on to the so-called, that what I'm going to talk about. Before I actually speak, I usually start my session with a true tale coming from the 1960s. This man was asked to speak to a group of Alcoholic Anonymous, support group, right? So for people to quit being addicted to alcohol or consumption of excessive alcohol. It's in the 1960s. It's a true story. So when he went to speak to this group of people, he told them, or he asked them a question. And he told them a story, So he says that there's a glass of water. When he put an earthworm into the glass of water, the earthworm tried to crawl from the sides of the glass to get out the glass itself, right? Now, then he says, when this earthworm is dropped into a glass of undiluted alcohol, the earthworm disintegrated. Okay. Now, then he asked the group, what's the moral of the story? Any guess? Anyone? What's the moral of the story? Any digger? No. Okay, never mind. So there was silence. It's okay, there was a silence. Then someone in the group shouted out, okay, I see that if you drink alcohol, you will never have worms. No, but this story is telling them don't drink alcohol, right? When he's going there, but he actually but people say, oh, actually I should be drinking more alcohol because I wouldn't have any worms in my stomach, in that case. Now, what is the moral of the story? The moral of the story is that, right, we can say anything to anyone. And in this room, right, every one of you will exit from this room with different interpretation of what I'm going to tell you or communicate. The reason is very simple. Because we have our own experiences. We have our own biases. It's okay. It's fine. Okay? Now, the thing is about being self-aware, but the second thing is about self-manage your conceptions. What you want to take away, you call. You are the one who call the shot. So I am just going to tell you this, whatever I'm going to say to you, it is not going to be an imparting of knowledge or just one-way transmission. It is going to be a co-creation of knowledge between what I'm going to say and what you already experienced. Okay? Now, before I talk about the adult learning principles, which I would like to contextualize in the future or in the context of the future of the healthcare, I need to actually surface to you a couple of things. Now, we know that the future of healthcare, we are facing aging population. We are facing land scarcity, right? We cannot keep building hospital, right? We have people that keep getting old. So what I'm trying to tell you is that learning needs to be contextualized. I don't want to tell you these are the principles of adult learning and so be it, right? I need you to think about adult learning principles in the context of healthcare. So in the Singapore context, right, we totally don't have the land to keep building hospital, okay? Now, of course, now we know that it's actually the transition from acute hospital to community care, right? So now instead of actually when you have a little sickness, you go to the hospital, preventive. You're supposed to prevent in terms of this thing here. Now, because of this, right, there is a significance attached to this future trend. What is the future trend? You are going to see more multidisciplinary teams. You are no longer going to see doctors, nurses, just operating in silo. Okay, I actually did a project on interdisciplinary mentoring, across the different practices. I actually work with allied health. Allied health at 30 over kind of disciplines, how to get them together. And allied health need to work with nurses, work with doctors, because what is the ultimate aim? The well-being of the patient. Full stop. Whatever you do, right, you have a final destination, the well-being of the patients in terms of the multidisciplinary teams. The second thing I'm also saying, even though I'm not in the healthcare, the so-called birth of new healthcare jobs. Because things are transiting. Nobody knows for sure what is going to happen between the transitions from the community, from the hospital to community care. One of the jobs that were birthed, for example, are health coaches. Okay, now it's a project that I'm working on because health coaches have actually been around for about 6-7 years. Actually come up with from another hospital that I'm working with. But they were asking, so what is the career progression of these health coaches? How do these health coaches work with the general practitioners? How do you get these health coaches to talk to residents who are older than you and tell you that I know what the heck I'm doing? There are a lot of different jobs that might be evolving. Or in some hospital, we are looking at job redesign. SNEC, whom we are also working with, tell me is called task shifting. Whatever we call, whether it's task shifting or job redesign, basically we're seeing both a new job and also integration of existing jobs. Now, because of this, okay, we need to build competencies, okay, which is my talk about today. Now, having this big macro view of what is going to be existing, right? When we talk about this adult learning principles, then when we talk about building competencies, we have to home in to actually our context, our own organizational context. One of the things we're looking at is multi-generational workers or employees. Very simple, because people live longer, right? People actually, then you have even a more multifaceted kind of group of people. Multicultural manpower is a very real issue in healthcare, right? You've got to depend on the people that we have right now. It's not going to be sufficient. Of course, not to talk about automation and things like that. I'm talking about human dimension here, okay? And then we're going to talk about adults, different ages, and things like that. Now, because of all this, I want to build competencies in the context of all these challenges that I'm facing, okay? Now, I am now going to speak about what this is adult learning principles about, okay? Now, this is actually have been around for a long time. Adults are not like students in school when the teachers tell you exactly what to learn. Today, we're going to learn about fractions. These are the learning outcomes, right? No, we don't, because an adult chooses the classes or the sessions they want to go into. Okay, I'm just being told that I've only 5 minutes left. Okay, so I have to go a little bit faster. Okay, now, so it's about goal-oriented, proud knowledge, experience, self-paced, learn by doing. Adults are autonomous, right? They decide what they want. Now, but of course, I want to say something. Not all adults know what they do not know. Neither all adults know what they know. Okay, I just want to talk because these principles are actually not new. Now, the question is about how. I want to introduce you two things, which is very, very important. Well, now, why do I say so? Because, right, in organization, a lot of building competencies, right, talks about having classes for these people. No, but classes can't be happening 24/7 every minute of the time because it will rob you of your working time. I will tell you very frankly, as I told all the industry bosses, you are hired to work, but now you're hired to work and learn. Okay, so when we are actually being besotted, right, or harassed by competing demands, what comes first? Working, because that's what our basic obligation is. Now, then the question is, some people say, how do I attend courses? And I'm going to introduce two things to you. Now, whether you have courses or not, you want learning to happen all the time. You know, self-paced at your own time. This is for you and also to educate those you're going to educate in the future. Now, of course, we talk about reflection on action. This is the very simple thing. People tell you, oh, go reflect after what you have done something, especially for causes, right? Now, this is what we call reflection on action. Now, a lot of time people ask, you ask them to reflect. The question is, reflect what? How to reflect? Okay. Now, the question is, of course, how to reflect and what to reflect. There's a couple of things. One, we have this one dimension, forward and backward. That means in the past, how would you have done it or what have you done? In the future, what you're going to do about it. The other one is inward and outward. Inwards means within internal, right? You think about the kind of things, you know, what your kind of thing. Outward means the constraint that you might face. So this could be a very basic framework. Of course, there are other frameworks. Now, this is what we call reflection on action. That means after you've done something. Now, what is the con of this? The con of this is sometimes you forget. A lot of things happen, right? Now, what you reflect on is, in fact, a critical episode of what happened, not everything. It's something that strikes a chord in you. Now, but what is more important is what I call a reflection in action. This is something that if you're able to educate your people and what you've been doing, right, that would be fantastic because it means learning takes place all the time. What is reflection in action? As I'm talking to you, I'm reflecting. So for example, right, you speak something to somebody, right? You're thinking, hey, is the person, you know, able to understand what I'm talking about? Am I doing this thing? Why am I doing this thing? I give an example. Okay, now I got 1 minute. Okay. So okay. So I give an example. I used to teach the teachers. I was an NIE lecturer. Okay. And one of the teachers is a president award teacher. And you know, she was telling the first year teacher to say, come and observe me in my lesson. So the first year teacher observed the lesson and then went to tell this president award teacher, perhaps you should have done this. And then the president award teacher was like, how dare she? I'm a president award teacher. How dare she tell me this thing here? But then she caught herself by saying that because she was doing reflection in action. Oh, I shouldn't be like that, you know, in the first place. The words that come out from her mouth is that, oh, perhaps maybe I should look into this. But when she was actually, when I interviewed her for my research project, she actually mentioned this to me. You know, this is what I call reflection in action. And it's super, super important because every day when we work, we observe how our colleagues work. When we work, we think about whether we are doing the right thing in the past if we do something. Okay, my time is up. Let me just conclude this thing first. And because of this, right, can I have a bit about 3 minutes more? Okay, maybe I just have about 3 minutes more. I don't want just abruptly things like that. So what happened was when we do the reflection in action, we are actually telling our people around, even though there are no classes happening, your colleagues are learning because they're learning very on their own. They're talking about reflection in action, reflection of action afterwards. So I think this is a two important, very important practices. This is what I call about inner dialogue. And sometimes, right, when we talk to ourselves, this is reflection in action. Sometimes we catch ourselves by saying that, oh, perhaps we're doing this. Maybe in the future, I could have done something. Then you ensure, even as an organization, learning, whether it's informal or formal, still counts as learning. So what you're doing is that aggregatedly, you can actually ensure that learning takes place all the time, despite no intervention from the organization. Okay, I won't actually go on to this because I don't have time. I have to actually give the floor to other presenters. But if you have the opportunity, what I really wanted to, I can share this deck of slides. Okay, it is workplace learning. This is actually what I shared with you just now. Features of workplace learning. You don't have to take, I can share the slides with you guys. Don't worry about this thing here. But I just wanted to share one thing. You know, they always talk about 70, 20, 10. 70 to this, 20 and 10. Today, I want to stand here and debunk that myth. According to a Harvard Business Review in 2004, 70, 20, 10 did not exist. Okay, it did not exist at all. It was some number that people randomly come up with, and a number of organizations are adopting this. Okay, so 70, 20, 10, it is a good instrument for people to actually organize the organizational learning, but it is not cast in stone. Okay. Okay, this is what I wanted to show you. Okay, these are some of the strategies for workplace learning. I just want to leave you with, this is some of the work we have done. I want to leave you with this QR code if you can. You can go into our website to find out some of the workplace learning strategies inside there. And it's very self-explanatory. We have about 30 over different learning strategies. There are tools and interventions used there. Okay, so with that, I just want to recap what I've said today. Number one, to build any competencies in adult learners, number one, you need to contextualize to their perspective, not your own perspective. Second, from an organizational point of view, you need to understand the bigger environmental issues and the context that we're talking about. When you zero in, instead of just looking at organizational intervention, look at individual intervention, which they can always use it and take place all the time without a so-called forced intervention on the organization part of you. And last, I just want to leave this with you. Workplace learning is the next big thing because it actually ensures continuity of learning. With that, thank you so much.